Hello, my name is Mariam Gugushvili. I am a medical doctor, reproductive medicine doctor also, and also obstetric and gynecologist. Today I want to talk about why IVF cycles are failing, and if you have been in the clinics of IVF and if you have taken IVF medical treatment, you have huge questions and I want to answer about these questions. I hope today's lecture will be very interesting for you. In gynecology, we are treating the patient. In obstetric condition, we are making observation, and during the IVF, we are giving you, this is IVF journey. Why IVF journey? What means IVF journey? This is very interesting because during the IVF, we have many steps and we have many options to give to our patients, and with them, we are choosing which one is best for them. During the IVF, it takes minimum 2 weeks to give the goals. So it is not just you are coming in our clinic and we are giving the answer and we are giving the reasons. Sometimes we need several steps to make this process. So IVF, let's talk how it starts from beginning till the end. And what is the end? For us, it is positive pregnancy test. So before we will start to talk why IVF is failing, now I want to talk what is IVF cycles, how it starts, how we are starting to communicate with patients. When you are coming in our clinic, what is happening in our clinic? So why our reproductive clinics are so quiet, so warm conditions? Because when you are coming with your history, we are listening very detailed. Just sometimes I need more than 1 hour to talk with couple or with patient, what is going on with her, what I am planning, what my treatment plan with her, what IVF journey I am advising her, for example. As I noted, the IVF cycle and IVF journey, it is multiple step process. It isn't just one manipulation. So every manipulation the patient must understand very detailed. I understand you are not a doctor, you are not medical staff. Sometimes for you it's very hard to understand what's going on in your body. And because of this, we are here to talk and to discuss all conditions what we have during the IVF cycle. We are starting from beginning. What is the problem? What is the main problem? And very important to understand during the first interview what we are going to do and what is the reason of infertility. Because after this we will know why it could happen fail of IVF cycle if they have already done. But sometimes they are coming to our clinic and they have no idea that IVF can be failed. Many of my patients, they are thinking that, oh my God, I'm going to the IVF clinic and they will give me 100% sure that I can give the birth, I can get the pregnancy, what I want. Sometimes it is not so high percent because during the natural cycle, the patient could not get the pregnancy. And IVF, it is assisted reproductive technology. So this means that we are helping to our patients to get their dreams. So about IVF and about ART, assisted reproductive technology. I want to tell you that it is not very new subject for us, for doctors, but now we are talking about this, and we have many subspecialty in this subject, in the IVF. We have huge clinics in the world, for example, who is making IVF. What is the difference? Do you know it? Most of us, we are working very hardly. We are very motivated to give the good result to our patient. What is our unique? It is listening. I think it's my opinion, but the first time when the couple is coming, my goal to listen them very detailed, to understand every little of their problems, not only gynecological, it is psycho-emotional and it is social problem. For example, it is general condition, general health condition, because sometimes they are having another general disease, for example, which gives the complication not having the baby, for example. So during the the IVF cycle, it's very important before making the IVF journey to have the good interview. I want to tell you that IVF reproductive technology, it is not a new subject. The first IVF baby was born in 1978 in England and in July 25, and she was the hope for the world that the infertility will be overcome, and it is suchly. Nowadays, I always tell to my patients, if you want a baby, you can get the pregnancy. As I noted, IVF cycles are huge in the world, and most babies who are born, it is like 1-3% from the IVF. By days, it's increased. Why it's increased? Maybe you will ask me as a doctor, why IVF babies are increased? Because we have high technology and we can give huge information and interventions we can make to have good outcome. So, but again, it is 21st century, but we have failed IVFs. So now we are working on this to make maximum to decrease the reason why IVF is failing. But sometimes it is not depending only on doctors. It does not depend only on medical center, only on embryologists. It is the global problem, and sometimes it depends on couples also. Today, now I want to talk very detailed about these problems. How IVF is starting in women condition, for example. It is, we are taking egg. Before we will take and we will make ovarian stimulation. Of course, we are checking the first patient in the starting of the menstruations, and we are making ovarian stimulation. In 13 days, we are making egg retrieval. We are taking ovums from the ovaries, and then we are checking in the laboratory condition. Our embryologist is checking under the microscope what kind of quality of ovums we take from the woman, and then we are, if everything is okay and sperm is also good quality, we are making embryo cultivation and embryo formation. And in several days, after checking that everything is going successful and several embryos are formed, we are making what? Embryo transfer. So it seems very easy, but it's very hard. And sometimes if we are having fail of IVF, always I am asking, in which process do you have the fail? In the beginning, in the middle process, or in the end process? For example, sometimes we are starting the IVF cycle, but ovarian stimulation is not good. Ovaries are not stimulating. So we hope that it's very rare condition, but it's happening. Okay, sometimes ovaries are very good stimulating, several follicles are coming, but during the operation room, during the manipulation, when we are taking these ovums, we are understanding, we are noting that ovums are not so good quality. Okay, we are going to the next step. It is sometimes ovums are also partially good. Our embryologist agrees that okay, some of them are very good. We are making the embryos, but embryo quality is not also good. It's also happening. Sometimes embryo quality is also good, ovary quality is good, sperm quality, but embryo transfer is failing. So if couple is coming to our office and if they already have done some manipulations, they have already visited some clinics, our goal is to detect what was the process in that clinic, and I always ask them what was the protocol, how they were treated, and sometimes we are changing our opinion and give them another way to be treated. Now I want to talk what factors can affect our IVF cycle. The main factor, it is age. And I want to tell you, of course, the age of female is very important. When we are taking the ovums also from the woman, and when we are making embryo transfer, for example, maybe age is very important. Of course, it's the best age of get the pregnancy, it is from 25 till 30. But most IVF cycles, what we are making, it is above 40. Of course, we are telling to our patients that as woman is getting older, her IVF results are also decreased. But we are making maximum to give the good results. But not only the age of the woman is very female, it's very important. Age of men also is very important. There are some research that they tell that it can impact the fertility results as the man is getting older. So when we are talking to a couple and they want on their ovum, they want their sperm to use, it's very important to understand their age. If the age is not so good, we are telling directly and we are advising another options, for example. But if they want that, no, Mariam, I want on my own gametes, I want my own sperm to use, I want my own ovum to use, we are explaining what they have to expect. Another risk factor, it is obesity. Obesity is on woman's side and on men's side also, because on men's side it can affect spermatogenesis and on women's side it can affect the quality of ovum. Because many young ladies, and many years ago maybe I also was thought, okay, she is has obesity, maybe she is having little high BMI, but she's having the ovulation, she's having the menstruation. What is the problem? No, problem is the quality of the ovum, because it's maybe she's young but have high BMI, high body mass index, and it gives the bad quality ovums, and due to this sometimes we cannot get what? Good quality embryos, and it gives the embryo transfer will fails. So it's very important during starting the IVF cycle to have consultation of endocrinologist, and if the patient and the couple have the problem of BMI and obesity, to decrease and make the minimum risk of this factor. I'm also gynecologist, and sometimes they are coming to my office as to gynecologist, and when we are checking and when we are advising, so as a gynecologist, I have done everything, but I cannot help you anymore because you need subspecialty and you need IVF clinic. Many patients are asking me, do you know why I cannot get this service when I'm with gynecologist? Because it is directly during the reproductive clinics we are motivating in small time to give you the results, because before this you have visited, you have tried everything to get the naturally the pregnancy. But if you cannot get the naturally pregnancy, IVF clinics, because of this we are helping and we are just advising. So the first consultation, it's very important, and if you have some questions, maybe you are outside of our country, you can contact, you can communicate, and online it's very helpful. For example, during the first interview when we are communicating, then they are arriving in our country, for example, and it's very important for communication, because the doctor whom you are believing your healthy condition, you must believe her, you must understand what is her plans about you. So in the IVF clinic, when the couple is coming, for example, we are asking what is the reason why they have come. Yes, since what time they are getting the pregnancy, they are trying to getting the pregnancy. If they already tell me 3 year, 4 year, 5 year, it means that, and we have checked so many times, and maybe they are having some not direct reasons. Yes, this means they have already problems. So one of the negative effect it can give us that, okay, they have already some problem, and due to this sometimes the IVF does not give 100% in the medicine, nothing is giving. So you have to remember this. Doctor who tells you that I am giving sure 100% that the result will be what you want, I don't think it's very good, because in medicine we cannot give 100% to nobody. Okay, one of the main reasons of the fail of IVF in any step, it is poor ovarian reserve and poor ovum quality. To understand not only in woman condition, but of course, as I noted, in men condition, it's very important about spermatogenesis. But now I want to talk why it's very important in a woman, the age of woman. The young lady, the young child is born with 1 million ovums. So you have the reserve of 1 million. And yes, you are getting in the puberty, you are making the ovulation, and 10-12 ovums are losing. So you are getting, as after 35, the reserve of this ovum is decreased dramatically. So when the patient is coming to my office, for example, she is not planning nothing, or she is planning partially, I am asking, what is your plan for future if she is 37, 38, 39, and she's telling, yes, I am planning the pregnancy. What you will advise? I am of course advising immediately to get ovum freezing or IVF cycle. Why? Because after 42, it's very hard to get your ovum good quality and to have the IVF cycle. Of course, I have huge patients who are coming and they are 43, 44, and they want on their ovum. And of course, I'm making maximum, but sometimes the IVF is not coming as we want. IVF is failing. But before this manipulation, we are very detailed explaining to our patient. But most commonly after 42, 43, we are advising to our patients to use donation of the egg, donation of the ovum. As I noted, age is important. Obesity is and BMI is very important. And one thing I want to tell you, not only high BMI, low BMI is also sometimes and mostly problem. So good BMI, good healthy condition is very important. The third, it is ovarian reserve. Fourth, it is good sperm quality, which depends not only age, but in the older age group we have sometimes poor spermatogenesis, and it's also very depends on the lifestyle. So lifestyle is very important in men condition, not to use tobacco, narcotics, to have a good sleep, to stop the alcohol using, and to have good healthy lifestyle. And it's very interesting that in men condition they have new spermatogenesis is coming in 3-4 months. So in 3-4 months after, if they make everything what I already told, they can have good quality of sperms. The next, it's very important, embryo quality, because most of IVF failing is coming on embryo, and embryo it's good quality or not good quality, and it depends how was our ovum and how was our sperms quality before making these embryos. But sometimes our embryologists are giving us already information that we have, for example, 2 good quality embryos, 2 not so good quality embryos, and embryo quality is determined by our embryologist. And in the next videos we will talk more detail about this, how are they getting it's good or not good quality. But before making this, I want to make sure sometimes when we are transferring, our embryologist is already tells us it's good embryo transferred or partially not good embryo is transferred. But most of course, when the good embryo is transferred and the pregnancy is not coming, of course we are checking what can be the reason. Do you know? Because everything was okay, endometrial was good, everything condition was good, hormonal condition was good, but why pregnancy is not coming? It can be not progressing. The embryo was good, but it does not progress. Implantation process was not so good. Implantation does not plagues implantation and continuing of the pregnancy. So of course it's very hard. And because of this, sometimes we have several embryo transfers, not only one. It's very rarely when you are transferring one embryo and it's the result is coming as what we want. Stress condition, what I'm always tell to my patients that of course I know you have this stress condition, you are emotionally when you're making this IVF cycle and IVF process and programs, but stress is very important because stress gives negative effect on pregnancy outcome. And I always tell to my patients that because of this, now we decided to give you this information, because when you know what is going on, your stress level will be less, of course, during the IVF process. Another, it's very important during this time that uterine problem. It can be uterus does not takes care of this embryo which was transferred, for example. Receptor and implantation does not take place as we wanted. So sometimes, of course, it is medicine, and as I started, it can be 100%, and sometimes we don't have the answer truly 100% why it fails. So but we are making everything to check every detail. It can be receptoral problem, endometrial problem, embryonal problem, or what kind of problem. Of course, another it is after embryo transfer, we are giving hormones to support, like a hormonal condition that gives additional supplement for implantation. Many of my patients are asking after embryo transfer, maybe I will be at home, I will not come out, not have the no, I'm told live as you was living. For example, have the same activity as you have before. Of course, the one of the big main factor, it is stress. So don't have the stress. Joy as you want, have a fun, have a quality of life. Your life must be the same as it was before. So if you will be under the stress, if you will be at home, don't stand up, it gives you additional risk factors. And if the everything is good, like embryo is good, receptors is good, endometrial is red, uterus is red, the implantation can take place. Now maybe you will ask me, okay, Mariam, before the consultation you told everything was good, so there was no problem, X was also good quality, everything. Why it's happening that implantation cannot take place? If the woman has the previous disease like gynecological, polycystic ovarian syndrome, endometriosis, maybe she has some fibroids, maybe she has some endometrial hyperplasia or some problems on endometrium, or some general systemic disease which is very common. This gives negative feedback to the implantation. This gives additional minus effect to our conditions. And of course, before embryo transfer and before starting the IVF cycle, we are very detailed explaining to our patients about these risk factors. And we cannot tell them that, it's nothing, it does not give you harmful, because not maybe implantation, but pregnancy must continue. It's very important as obstetric and gynecologist. Now I am telling you that okay, implantation takes place, pregnancy test is positive, and then what is starting? We want good, healthy newborn. Now you can tell me, there are many couples who you can check in the internet that they have several IVF fail, and the 11 IVF protocol was useful. Maybe in the 7 embryo transfers they have the results. What is the reason during this time? Sometimes we are changing protocol, sometimes we are changing management, sometimes we are advising different kind of treatment plan, and of course sometimes it's very important emotional and believing factors. And when the couple believes in you, it gives you partially done job. So our goal, my goal and our clinic's goal, to give maximum information to our patients, of course, about positive feedbacks and about negative feedbacks also. Every time it's very important to discuss with patients why we are giving any kind of treatment, any kind of option. For example, sometimes patients are coming with one options. For example, I want this, I have read about this, I have asked another doctor, and sometimes we are telling them, no, we are seeing that not this protocol and this option is very good for you, for example, another. And they are going home, think about this, and when they are coming back and they are agree with us, for example. It's very important to be open in front of patient, and patient must believe to you also. I hope this topic and this video will be very helpful for you.